Hello and welcome to this lecture video. I'm Dr. Negar Bouzari, and in this video we are going to talk about fluoride and its positive effects on our dental health. So let's begin. What is fluoride? Fluoride is the ionized form of the element fluorine, which is the most electronegative element and thus highly reactive. It readily forms ionic compounds with metal ions, such as the calcium and sodium ions. So, how does the fluoride prevent caries formation or tooth decay? To answer this question, we have to first get more familiar with the mineral structure of our teeth and the process of caries formation and how this process affects the hard tissue structure of our teeth. The tooth. So let's first discuss about the structure of our teeth. Our teeth are made out of both soft and hard tissues. The hard or the mineralized tissue covers and protects the inner soft tissue, the so-called dental pulp. The primary unit of hard dental tissues is the hydroxyapatite crystal. As you can see on the screen, the hydroxyapatite has the following chemical formula. It consists of two different calcium salts, the calcium phosphate and the calcium hydroxide. An important feature of hydroxyapatite is that it can go through ionic exchange, in which the hydroxide ion can be exchanged and replaced by ions such as fluoride, and thus forming a new crystal, the so-called fluorapatite. We will get back to the significance of fluorapatite in just a few slides. So now that we got more familiar with the structure of our teeth, let's see what is caries or tooth decay. Caries is a multifactorial chronic disease which is mediated by the bacteria. But for the purpose of this lecture, we can simply define it as the loss of dental hard tissues under the effect of weak acids produced by the cariogenic bacteria. And the cariogenic simply means the bacteria which cause the caries. During this process, the weak acids produced by the bacterial fermentation of dietary carbohydrates dissolve the dental hard or mineralized tissue. The dissolving of the mineral ions, mainly calcium and phosphate ions, from the crystal lattice of hydroxyapatite is called demineralization. If the minerals are replaced back into the partially dissolved hydroxyapatite crystals before its complete disintegration, the demineralization can be reversed, and this process is called remineralization. At each certain time, there is ongoing processes of de- and remineralization happening on teeth surfaces, and the balance of these two determines whether we would have hard tissue loss or not. But after a certain point, the demineralization can no longer be repaired and reversed by remineralization, and thus cavitation will occur. The dynamic processes of demineralization and remineralization. As you can see on the left-hand side of the slide, we have a simple representation of an intact dental hard tissue which is confronted by an acid attack. This causes the demineralization of this structure, losing parts of its mineral content, mainly the calcium and phosphate ions, but the lattice of the hydroxyapatite is still maintained intact. At this point, if the conditions change in favor for remineralization, for example, the buffer system of the saliva neutralizes the acids, then the lost mineral ions can be replaced back into the lattice, and this process can be reversed. But if this does not happen, and we would have continuous and repeated attacks of acid, the lattice of the hydroxyapatite will also lose its integrity, and cavitation will occur, which is no longer reversible. So now that we have covered some of the basics, let's go back to the fluoride itself. So far, we have mentioned the bacterial acid production and processes of de- and remineralization. And fluoride comes into play in all these three processes in favor of the caries prevention. Fluoride mechanisms of action. The first one. Fluoride directly inhibits the enolase enzyme activity of the oral streptococci, which is one of the main cariogenic bacteria. This enzyme is involved in the transport of sugar into the bacterial cells, from the fermentation of which the acids are produced. In this way, the presence of fluoride can prevent the production of acids by bacteria and thus prevents and decreases the acid attacks on the dental hard tissues and caries formation. Fluoride mechanisms of action, the second one. As mentioned earlier, fluoride has a very high affinity to react with calcium ions. Thus, when it comes into contact with the hydroxyapatite crystals present in the dental hard tissues, it reacts with the calcium present in the hydroxyapatite and replaces the hydroxide ions, forming the so-called fluorapatite crystal. The fluorapatite. As you can see on the screen, it has the following chemical formula. And if you compare it to the chemical formula of the hydroxyapatite, you can see that the fluoride has replaced the hydroxide ions. Significance. Fluorapatite has a more compact and regular crystal structure compared with hydroxyapatite, and this decreases the surface area available for acid attacks. Fluorapatite is much more resistant against acid attacks compared with hydroxyapatite, so a stronger acid is required to have similar effects on fluorapatite. So, in this way, fluorapatite decreases the demineralization. Fluoride mechanisms of action, the third one. Fluoride also enhances the remineralization. Presence of even low concentrations of fluoride can facilitate the precipitation of calcium and phosphate ions from saturated solutions in the form of apatite. This apatite can then be replaced back into the demineralized lesions in the process of remineralization. In conclusion, fluoride has a very strong beneficial role in maintaining our dental health and prevention of caries. Dentists should assess the caries risk for each individual patient and suggest the necessary fluoride treatments and their intervals to their patients. As always, the golden standard for maintaining oral and dental health is the optimal oral hygiene and diet, and these cannot be replaced by any other means. So we have reached to the end of this lecture video. I hope you have found it helpful. If you have any further questions regarding this topic, feel free to leave them in the comments and I will try to answer them as much as I can. Take care and see you in the next video.